By now, you know Dolly Parton died this week. She was 80 years old. And now we know she died after a brief battle with cancer. Last year, after losing her husband of 60 years, Dolly began struggling with her own health, but did not disclose any details until now. 9 News health expert Dr. Paul Coley joins us now. Dr. Coley, we don't know if it was any kind of delayed diagnosis. We just know she's telling us about this now. Does this happen a lot with caregivers? Because over the last 24 hours, I've been talking to a lot of people who say, oh yeah, my father did that, my mother did that. In
fact, in the medical community, Phil and Kim, we're saying that caregiver diagnoses or delayed diagnoses is one of the biggest public health problems, because what happens when you become a caregiver is you actually become the invisible patient, right? Because you neglect yourself, and Dolly said that she had neglected herself. You don't get your routine screenings. And when you're older and geriatric patient, you're dealing usually not with one chronic problem, but usually multiple chronic problems sort of intersecting together. So regular treatment, regular screenings, regular checkups at the doctors is just so important. But when you're busy taking care of someone that you love so much, you start neglecting yourself.
I think a lot of people would say, oh, well, you know, she had access to going to everything, but no one can put themselves in that spot of grieving and caring for somebody else. And I think she mentioned autoimmune and some other things. So the screenings itself is what you really need to get yourself out the door to do?
Yeah, so I have a couple of comments on that. The first is, imagine being married to someone for 60 years and then losing them. And so we often see this in older couples. When one goes, that first year after that one of the two spouses goes is usually the highest risk period health-wise for the other spouse, because they tend to not just have to deal with the collateral damage of picking up the pieces of not taking care of themselves, but also the bereavement grief causes mental health problems. In fact, we see caregivers have a higher risk of hypertension, inflammation, cancer, heart disease. That, you know, layered onto the fact that she was already dealing with not one diagnosis, which is cancer, but autoimmune, kidney. We know she had a kidney infection. We see this often as well, where you have older people juggling so many health problems, in addition to obviously the fact that they're not as sharp as they used to be. So even remembering to get those screenings can be a challenge. So I think that's where the health system sometimes fails our older population, because we rely on the patient to take care of everything. And it really should be up to us to say, Dolly, like, you need to focus more on yourself, and I know you're taking care of your husband, but we need to do better with your health as well.
And I just feel like this next question comes from Dolly Parton. Everything that we know about her, how caring she was, not only for her husband of 6 decades, but everybody else. She used to say, we're all God's children, I love everybody. I would think she'd want everybody to learn from this situation. So what would you say to folks who are in that? And I know it's get your screenings, but how would you go about taking care of yourself, and what can we learn from what she's telling us now?
You know, Dolly Parton has taught us so much, right? Through her songs, through her life. I will say one other thing, which is that the way that she engaged with her fans, engaged with her art, all the way till the end, is also one of the lessons she taught us, which is that just because you grow old doesn't mean you give up on life and engagement, because that keeps you young as well. That actually reduces risk of disease. Certainly, as you said, Phil, important to think about yourself and getting those screenings on time, especially the cancer screenings, because cancer is a disease of aging. So if you can catch it early, it's curable. But if you don't catch it early, those cells can spread, and it actually limits your treatment options, which affects your prognosis. So the cancer piece is certainly one part of it. But also, I think the idea that you just need to make sure that you focus on seizing the day, working till the very end, making sure that you stay engaged with what makes you happy. And I respect the fact that she was very private about her cancer diagnosis, but I think she has taught us so much through her life, and now, of course, in her death. I am telling all of my older patients I'm writing a prescription for social engagement and listening to some Dolly Parton music, just because I think she really has told us that that piece of it that we don't think about so often is staying connected is also so important.
Huge difference. I think that kept her alive too, being out there and doing, because she just wanted to keep working.
That's right. And she was so amazing at it. So what a loss for us. But again, she's left us with so many things we'll remember.
Always.
A legacy.
Dr. Coley, thank you.
Dr. Coley.